Heart attack symptoms in women. Just recognizing one of these 9 signs can help you save yourself from a silent heart attack, one you might never expect. I've met many female patients who only felt tired and had back pain, but after tests, they were shocked to learn they were actually having a heart attack. What's worrying is that most women aren't properly warned about heart attack symptoms because they're very different from men's. Many think the heart only hurts when there's chest pain, but in reality, the heart can send signals through very subtle symptoms that are easy to miss. In this video, I'll show you 9 silent signs of a heart attack in women and how to tell them apart from normal symptoms. Just knowing early can help you keep your heart healthy and avoid serious complications in the future. Sign 1. A heavy pressure in the chest, not sharp pain. One of the biggest misconceptions is that a heart attack always starts with sharp chest pain. That might be true for men, but in women, the first sign is often a heavy, pressing feeling in the center of the chest, not pain. Many describe it as if someone is sitting on their chest or like being squeezed tightly. Some women think it's just heartburn, acid reflux, or a vague discomfort, and they brush it off.
But here's the thing. The heart doesn't always send clear signals like your skin or muscles do. When it's not getting enough blood, it can create a deep, dull pressure, a burning sensation, or a heavy weight inside your chest. For women in midlife and beyond, especially if you have high blood pressure, diabetes, or high cholesterol, even a mild pressure in the chest can be a serious red flag. If it lasts more than a few minutes and comes with fatigue, nausea, or shortness of breath, it could mean a heart attack is already happening. I once saw a woman in her early 50s who felt a little pressure in her chest after lifting some bags. No pain, no shortness of breath, but thankfully she got checked, and that's how we caught a heart attack she didn't even know was happening. So if you've ever felt heaviness or tightness in your chest, don't ignore it. Get your heart checked. One small action can save your life. Have you ever felt something like that? Share it in the comments below. I read every one. And if you've ever blamed shortness of breath on just getting older, wait until you see what's really going on in the next sign. Sign 2. Shortness of breath during light activity. If you feel out of breath or winded while doing things that used to feel easy, like walking, climbing stairs, or carrying something light, that's not just a normal sign of aging. When the heart doesn't get enough blood due to blocked arteries, the body starts running low on oxygen. Your heart works harder, and your lungs try to compensate by increasing your breathing. The result? You feel short of breath, even without heavy activity. This is one of the earliest and most common signs of a heart attack in women, especially women over 50 who have conditions like high blood pressure, diabetes, or high cholesterol. Sadly, many women dismiss it, thinking it's just fatigue, the weather, or that they're slowing down. I once had a patient in her 60s who only felt mild shortness of breath while walking around the house, but it turned out to be a heart attack. Thankfully, she got checked early and received timely care. If shortness of breath comes on suddenly or gets worse over a few days, don't brush it off. It could be your heart's first warning sign. If missed, a heart attack or stroke could hit without warning. Have you ever felt out of breath doing something light? Share your experience in the comments. Your story might help wake someone up to a danger they're ignoring. If you've ever found yourself breathless during light activity, even just once, write it down. Talk to your doctor and get your heart checked. A simple test today could prevent something serious tomorrow. Coming up next is a sign that many mistake for just low blood pressure, but it's actually a clear signal from your circulatory system. Sign 3. Dizziness, lightheadedness, or feeling like you might faint. No one wants to suddenly feel dizzy or like they're about to faint, especially when doing something simple like standing up, walking around, or just getting out of bed in the morning. But for many women, this can actually be the first sign of a heart attack. Please don't ignore it. When the heart isn't pumping enough blood to the brain due to a blockage or irregular heartbeat, your brain may not get the oxygen it needs. That's when you might feel off balance, your vision may blur, or you feel like you're going to pass out. A lot of people assume it's just low blood pressure, lack of sleep, or being tired. But if it comes on suddenly, for no clear reason, especially if it's paired with fatigue or shortness of breath, take it seriously. I once saw a woman, almost 50, perfectly healthy, who felt dizzy while cooking. No chest pain, no heavy breathing, but an EKG showed she was having a mild heart attack. If she had waited, the outcome could have been much worse. Dizziness might seem like no big deal, but it could mean your brain is getting less blood because of a heart attack. In some cases, it's the last warning before the heart stops. Have you ever felt dizzy just from standing up? Has it happened again recently? Share your experience in the comments. What seems small to you might be a big warning for someone else. If dizziness keeps coming back, don't brush it off. Take 15 minutes to get your heart checked. It could save you from a heart attack or stroke down the road. And the next sign? You won't believe how simple it is. Something almost everyone has felt at some point. But that's exactly why so many women miss it and miss their chance to survive. Sign 4. Unusual sweating. No one usually thinks sweating has anything to do with the heart attack. Women often blame sweat on hot weather, stress, anxiety, or simply hormonal changes. But the truth is, unusual sweating is a classic sign of a heart attack, especially in women. When the heart isn't getting enough blood, the body reacts by activating the sympathetic nervous system, similar to the fight or flight response when in danger. This causes your heart rate to increase, blood pressure to change, and your body to break out in sweat, often cold sweat, even without physical activity. If you notice you're sweating much more than usual while doing light tasks, or even when you're at rest, especially if it's accompanied by fatigue, chest heaviness, nausea, or dizziness, this is not normal. I once saw a woman in her mid-50s who came to the hospital for a simple reason. I was sweating through my shirt while sitting at work, even though the air conditioning was on full blast. She had no chest pain, no shortness of breath, and no dizziness. But her ECG showed she was having reduced blood flow to her heart. We transferred her to a specialist center and were able to stop a severe heart attack in time. The problem is, many women never think sweat is related to their heart. Because of that, they miss the golden window for treatment. Have you ever suddenly broken out in a cold sweat while just sitting or doing light work? Did you think it was just fatigue or stress? Or could it be a warning sign from inside? Next time this happens, don't ignore it. Note the time and how you feel, and if it happens again, take action and get your heart checked. It's a small step that could help you catch silent problems before it's too late. Because in reality, there's a type of pain that's easy to miss, especially in women, but it's a classic heart attack sign. No chest pain, no shortness of breath, just pain in the shoulder or arm, and you need to know how to recognize it.
Sign 5. Pain in the shoulder, arm, or back. Most people think heart attacks always come with chest pain, but in reality, many women don't feel any chest pain at all. Instead, they experience vague aches in the shoulder, arm, or even the back. This pain may be dull or come and go in sharp waves. It often shows up in the right shoulder, right arm, or the middle of the back, areas that are easy to mistake for muscle strain, joint pain, or overexertion. But because it's not the classic symptom, it's easy to overlook. When the heart isn't getting enough blood, the pain doesn't always stay in the chest. Especially in women,
The pain signals can spread to other areas, like the shoulders, arms, or back, because the nervous system connecting to the heart is more complex and wide-reaching in women. And that's exactly why many women miss the signs. I once had a female patient in her 70s who came in just for pain in her right shoulder after mopping the floor. No chest pain, no shortness of breath, no dizziness. An X-ray showed nothing wrong with the shoulder. But because something didn't sit right, we did an EKG and discovered she was in the middle of a heart attack. Thankfully, we caught it in time. The problem is, if we hadn't looked deeper, she might have been sent home with just pain medication, and a few hours later, things could have turned tragic. I've seen this happen more than once in all my years of practice. So I want you to ask yourself this. Have you had shoulder or back pain recently? And are you sure it's just from age or overwork? Have you ever felt an unexplained ache that didn't go away with rest, but you ignored it thinking, it'll probably go away tomorrow? Listen to your pain wisely. If you feel discomfort in your shoulder, arm, or back for no clear reason, stop and check. Are you also feeling tired, short of breath, or a little nauseous? If so, don't wait. See a heart specialist as soon as you can. Early detection could be the difference between life and loss. Now, the next warning sign is even easier to miss because it doesn't happen during the day. It happens while you're lying in bed. And if you don't catch it in time, you might wake up in the emergency room. Sign 6, insomnia or restless sleep. Many women brush off insomnia, especially after age 50. But very few know that trouble sleeping can actually be one of the earliest warning signs your heart sends before a heart attack. Not chest pain, not obvious shortness of breath, just trouble falling asleep, waking up in the middle of the night, and feeling completely drained in the morning. This happens when the heart starts to function less efficiently, causing mild disruptions in your autonomic nervous system, the part that affects your sleep quality.
I once saw a healthy woman who came in simply because she always felt exhausted when she woke up. No one suspected heart disease until her EKG showed signs of silent ischemia, meaning her heart wasn't getting enough blood. The problem is, subtle changes like these are often ignored and only taken seriously after a heart attack has already happened. So if your sleep has gotten noticeably worse and you're feeling fatigued for no clear reason, don't wait. Get your heart checked. Don't wait for chest pain to start worrying. And what may surprise you even more, some heart attacks begin with just a wave of nausea. Many women think they've just eaten something bad, but a few hours later, they're in the emergency room. Sign 7, nausea, vomiting, or stomach pain. Nausea and stomach discomfort are such common symptoms, and that's exactly why many women never connect them to their heart. In many cases, a woman's heart attack doesn't start in the chest, it starts in the upper abdomen. The feeling may be like bloating, mild nausea, or cramping, easy to mistake for indigestion, especially if it's followed by vomiting. But if you have risk factors like diabetes, high blood pressure, or excess weight, mistaking it for a stomach issue could be dangerous.
I once saw a woman in her 60s who came to the hospital after vomiting repeatedly after a meal. She was convinced it was food poisoning or a bad stomach, but heart tests showed she was having an acute heart attack. Here's the catch. The stomach and the heart share a network of sensory nerves in the upper abdomen. So when the heart is in distress, the brain might misread the signal and send pain or discomfort to the stomach instead of the chest. That's why nausea in women should always be looked at carefully, especially when paired with fatigue, cold sweats, or mild chest pressure. So if you're experiencing unexplained nausea or vomiting without a clear reason, don't just assume it's the food. Let your doctor rule out your heart first before you chalk it up to your stomach. And there's one more symptom that seems harmless, fatigue, but not the kind you feel after a busy day. This is deep, unexplained exhaustion, something many women experience just before their heart stops. Sign 8, Unusual fatigue. If you feel completely drained, even without doing anything strenuous, or if just a few small tasks leave you wanting to lie down and rest, that could be an early warning sign from your heart. In women, fatigue caused by reduced blood flow to the heart often has no clear cause, lasts for several days, and doesn't improve with rest.
It's very different from the tiredness you feel after a poor night's sleep or a long day of work. I once saw a woman who came in simply because she felt an unusual kind of tired. No chest pain, no shortness of breath. But after testing, we discovered she was quietly experiencing silent ischemia. Her heart wasn't getting enough oxygen. If your body is sending signals through persistent fatigue, don't wait. Let your doctor check it early. Don't wait until the fatigue is joined by chest pain to take action. Because the final sign we'll talk about is one that's often mistaken for a toothache, but it could actually be the last warning your heart gives you. Sign 9, neck or jaw pain. Many women come to the hospital with a dull ache in the jaw or an uncomfortable feeling in the neck and simply think it's a tooth infection, jaw strain, or sleeping in the wrong position. But few realize these can be signs of a heart attack. The cardiac nervous system in women often causes pain to radiate to the neck, jaw, or ear. So sometimes a heart attack doesn't show up as chest pain but borrows other areas to express itself. I once saw a patient who only complained of pain in her left jaw with no typical heart symptoms at all. But when we did an ECG, it showed she was in the early stage of a heart attack. The danger is this: the more atypical the symptom, the easier it is to overlook. And with pain in the neck or jaw, many women choose to see a dentist instead of getting their heart checked. If you feel unexplained pain in your neck or jaw, not related to chewing, sleeping, or movement, get your heart evaluated. Early caution can help you avoid serious risks. These are the 9 signs, none of which look like the classic heart attack men experience. That's exactly why women often miss them until it's too late. It's not always chest pain. Sometimes it's unusual fatigue, persistent insomnia, cold sweats, or pain in the shoulders, jaw, or neck. These may seem minor, but they could be the first and only cry for help from your heart. What I want you to remember is this: women aren't weaker than men, but women's hearts tend to be quieter when danger strikes, and if we don't listen carefully, the cost can be very high. Please share this video with your loved ones, friends, and all the women you care about, because just recognizing one early sign can save a life. Thank you for watching today's video. See you in the next one.